What to do after a fall. Today I want to talk about home care versus rehab centers. As we all know, or maybe you don't know, one fall can change everything. In fact, for most seniors who lose their independence, start with one single fall. And families are often forced to make a decision within hours, not weeks. So should your loved one go to rehab after the fall, or can they safely recover at home? Today, I'm going to walk through exactly how to decide and how to avoid the biggest mistake families make after a fall. Falls are one of the most common reasons older adults end up in the hospital. According to national data, 1 in 4 seniors falls each year. And falls are the leading cause of injury related hospitalizations among adults over 65. But here's what families aren't prepared for. The fall itself is often not the most dangerous part. It's what happens after the fall that determines whether someone regains independence or declines. So today, we're going to break down what to do immediately after a fall, the difference between home care and rehab, when rehab is necessary, when home care may be a safer, smarter option, and how to avoid rush decisions that families may later regret after a fall. So first things first, what to do immediately after a fall. Of course, don't rush the decision. If your loved one falls, absolutely call 911. If there's a head impact, there's confusion, there's severe pain, inability to stand, even if they quote unquote feel fine, falls often cause delayed symptoms. Doctors will rule out fractures, internal bleeding, or any immediate neurological injury. Now, here's an important truth. Discharge decisions often happen fast from a hospital, so within 24 to 72 hours. So, of course, families are pressured to choose between rehab and being discharged to the home before maybe they fully understand all the risks. And this is why I made this video. Education matters. Option number one. So let's say call 911, they're in the hospital, you're being discharged soon. Let's talk about rehab facilities first, also known as skilled nursing facilities or SNFs or short-term rehab centers. Rehab is usually recommended when there is a fracture or post-surgical recovery. The person cannot transfer, meaning move from location to location. They can't walk or toilet safely or independently. There's a significant decline in mobility, and frankly, multiple therapies are required daily, so PT, OT, and speech. Now, there's pros of rehab, of course. There's daily therapy, there's medical oversight, it's a structured environment for recovery, and there's medical staff all around. Now, here's what families don't often realize. Rehab stays are usually very short. It can be as short as 7 days up to 21 days, 30 days. Therapy may be limited to 30 to 60 minutes a day. Staffing ratios are higher, of course, so patients may be waiting a long time for help, or if they're incontinent, you may be sitting in your diaper for a while, as an example, and falls still happen in rehab centers. So rehab is not a long-term solution. It's really a bridge. Okay. Now that's rehab. Now moving on to option two, recovering at home with home care. Home care is often misunderstood. Home care is non-medical. It's hands-on support provided in the home, which usually includes helping with walks and transfers, bathing and toileting assistance, fall prevention and supervision, medication reminders, meal prep, cooking great meals and meals that are nutritious, hydration, offers monitoring and support for PT and OT. Home care is often best the option when the fall is not of high acuity or doesn't cause a major fracture, right, where you can recover in the home. The person can follow instructions in the home. The home environment is safe. The family wants to reduce infection risk, often happens in SNFs. And rehab could be emotionally or cognitively really overwhelming for the loved one. And the reality is most seniors want to recover emotionally at home. Being in a familiar surrounding, of course, prevents confusion, depression, agitation, and any risk of delirium. And with the right care plan, home recovery, my perspective, can be as safe or safer than rehab. Again, it depends on the acuity. Okay. Now, the biggest mistake families make after fall is assuming if we don't choose rehab, we're neglecting our loved one or our aging parent. That's simply not true. Rehab is a tool, not the default answer. What actually matters is supervision, mobility support, fall prevention, and some form of consistency of care. A few days, a few hours a day of professional home care can prevent home repeat falls, hospital readmissions, family caregiver burnout, the family members helping out, and any rapid functional decline. Some other special considerations, of course, after fall is also consider any chronic conditions your loved one may have. Seniors with dementia, Parkinson's, stroke history, frailty. Depending on that situation, rehab can sometimes worsen the confusion, leading to increased agitation because there's an additional chronic condition you need to assist for or account for. Home care allows caregivers really to customize the care, right? If there's a chronic condition, provide a calm reassurance in a safe, again, familiar environment, and maintain a routine in a comfortable home situation. Also, the fear of falling often causes people to stop moving, which accelerates decline. And I find one-on-one caregivers can help reduce that and increase that confidence for that loved one. So how do you decide really between rehab, again, and home care? Ask yourself these questions. Can a loved one walk or transfer, move safely with some assistance? Are they mentally able to follow instructions and want to follow instructions, frankly? Can the home be made safe? Maybe it's not safe, so it might not be the right place. Do they need medical rehab or daily support? Maybe you need to go to a rehab center then. What environment will actually help the person recover? And no one size fits all, but there is a right answer if you follow these questions as a family. So if your loved one recently fell or you're feeling overwhelmed, I want you to know, and this is why I made this video, is you're not alone. The right care at the right time can mean a big difference between independence and decline, confidence and fear. And really, I always encourage you to talk to your care professionals, care team professionals, understand both rehab and home care, and hopefully, and they should be guiding you without any much pressure. So if you found this helpful, as always, please like, subscribe, share this with someone in a conversation where every family needs to have before the next fall happens.